You went to Podunk Towns.
We're not big towns, they're just good places, but Wabash, you sit in the hot water.
That's true.
Like all the cases, they're like super complicated, like medically. I feel like they don't always do this, but like that's when you're super high. Like, that's like, okay, so this heat start is I will be prepared for this, but I'm not going to die. So I'd rather.
It's a whole different setting.
Yeah.
It's a whole different.
Yeah. So
They're all like, yeah, so
I have an idea.
it's like I go to the gym every day and I do this and that. Hi, how's it going? I'm Terrence.
Hi, how's it going?
Nice to meet you. You go by
I think it was Nora.
Nora?
Yeah,
Nora. Okay.
You can do whatever. you want.
I'll do Bogan today.
Okay, Bogan. Great. That's not what I had on the sheet, so I'm glad that you clarified that for me. Yeah. Okay, let me just write that down so I don't forget it, because I will probably call you Nora.
Alternate name use is fine.
That's right. Okay. All right, great. So how are you feeling today?
I don't know. My knee just really hurts.
Yeah.
And I feel like I can't do anything. I feel like I'm just like going downhill sort
All
of.
right. Well, sitting like that probably doesn't help.
Yeah. So,
Yeah.
yeah, I don't know. I don't know what to do. I just can't move around and my legs. I'm always in pain.
Yeah.
But I think I'm starting to kind of turn the corner, and I'm hoping I'll start getting a little better. But just a lot of pain right now. Yeah.
Yeah, I get that. Yeah, that's very frustrating, right? Especially, after a team of doctors rips you like it's hard and get you back together, right? It's not very fun.
No.
Well, I looked over your intake form a little bit. I have some follow-up questions I'd like to ask you. Are you okay with that?
Yeah.
Okay, so first off, so I saw you're an author. Is that
Yeah.
right?
Yeah.
Okay, I thought I recognized your name before. My mom read all your books. Yeah,
Sweet.
so
I hope you
I
like
have to get a signature before I leave from you.
What can do?
Yeah, so talk to me about a little bit about your living situation. So you said you're having a hard time going upstairs. Do you have stairs in your home, going into your home?
So I don't have any direct stairs. I don't have any stairs inside anywhere.
Okay.
But to get into my house, I have this like little, they're like platforms almost. It's like 5 platforms going up.
Okay,
So I have room for my walker to go up.
right.
Just getting up that step can be difficult. I can't use
Him or
this
outside?
leg at all.
Yeah.
I don't know. I don't have the strength to get up, but it is nice. I can use my walker. There it is.
Okay, so you can get up, it's just difficult to get up.
Yeah.
Okay, but as far as inside the home, there's no stairs, it's just those kind of risers.
Yep.
So, and then I read on your sheet as well, so you ranked kind of your problems from worst to least. So you said that function was your biggest
Yeah.
problem,
Yeah.
right? And then you've told me that your pain is a 10 out of 10 when you do have pain at your worst.
Yeah.
Does
We're
that
just
sound
10 out of
accurate?
10.
Yeah.
Yeah. It's pretty excruciating.
All right. And so do you also feel like that's probably one of the bigger problems that you're having right now, or is there other things that are more important than just getting out of pain?
I mean, the pain is really bad, but I've been in pain for the last like 4 or 5 years since my very first knee replacement. So I can kind of bear with it, but 10 is a little high. I would like to just be able to get around a little better.
Yeah.
Yeah, the pain. It would be very nice if it wasn't so painful.
And I saw you're taking hydrocodone, is that correct?
Yeah.
Okay, are you taking that for your knee pain?
I'm pretty sure the doctor prescribed it for my headaches. So I've been taking it for my headaches.
Interesting. When you take it, do you notice a difference in your knee pain at all?
It seems to maybe help a little bit. Like I don't really think about my knee as much. It seems like. Yeah.
Right, okay.
So it helps some.
So explain to me a little bit more about these headaches. You said you've had a history of headaches,
Migraine.
Migraines, yeah.
All
So
right,
I've had a little history of migraines. Yeah, and that's all they've given me to really help with it.
Right.
It's good to know. So part of my examination.
Right now I'm good. I haven't had one.
Okay. And then have you noticed that it affects like your recovery from your knee? Does it ever like lay you down for an entire day? Have you seen any other doctors?
I think it has in the past done that, but it hasn't since my replacement. I haven't had just been wiped out by it yet. So I hope that doesn't happen.
Gotcha. Okay, well, if at any point during our rehab sessions, if you are having migraine symptoms, please let me know just so we can get it figured out. and just take care of it, right? Because the last thing I want to do is is have to send you to somebody else because we did something too much.
Yeah.
Does that make sense?
Yeah.
All right, so talk to me about your surgical history a little bit. So you said you had 5 knee replacements.
Yeah. So most recently, I just got this one done, the right one. But in the past, I had osteoarthritis, is I think what they're calling it, and I had like a partial. It was like partially done, but then it didn't work out or something. So I went back in, and they recommended a total knee replacement. So I got that, and then there were some complications, and apparently they like clipped a nerve or something. So that just caused a whole bunch of weakness. And then the same doctor who clipped the nerve, recommended another total knee replacement. So I got another one. So I've had 3 on this knee, and it's still just as weak. And that's like I have trouble with stair conditioning still.
Okay, so you still have long-standing weakness.
Yeah.
Where do you notice it the most?
Probably just around the knee, maybe like above the knee, mostly.
Sorry, I have to write things down, or
Yeah,
else I'll forget them.
Of course.
Yeah.
And then so after that, I had another partial knee replacement on this leg, and then most recently I just got a total knee replacement done on this leg.
And you had the partial knee 13 years ago, is that correct?
Sure, I believe so.
Okay,
Yeah.
okay, yeah, that's what I read, so I was to make sure I had that right. Okay, good. And then it also says you had a left total shoulder
Yeah.
replacement. Okay, any complications with that at all?
No, nothing. Like I had physical therapy for it, and everything worked out well, and I got most of my motion back.
Okay,
And I feel like I have strength to use a walker.
good. Good. So you have had physical therapy.
Yeah.
Okay, did you have a good experience when you went the first time?
The first time it was kind of hard, but eventually I started getting used to it, and that seemed to help a lot. But it did help a lot for the shoulder.
Okay, good. Did you have it for your knee as well?
Yeah.
Okay.
It was still a good experience.
Okay, good. Yeah. So, I mean, you've obviously been through this before,
Yeah.
right? And you've been through the process. Talk to me about how it's different this time. So you said you're kind of still in the pain zone
Yeah.
where you feel like maybe you shouldn't.
I guess it's just kind of the fact that now it's both legs, and that's making it even more difficult rather than just this leg. I've been dealing with this leg for years and years, and now it's this one too. So,
Yeah, that could definitely be disheartening. So I understand why you feel that way. Right?
Yeah.
But, I think hopefully by the end of the time that we've worked together, that you come to visit me, that we can get you out of pain and get you feeling better. And I think you're going to do good things here. Talk to me a little bit more about your sleep. So you said you're having some sleep disturbances. Is that mainly just due to pain?
Yeah, it's mostly due to pain. I'll like wake up a few times throughout the night. I feel like I kind of roll over or something, and that just hurts my knee, and I wake up from that.
Okay, but you can find a comfortable position after that.
Yeah,
Okay, good. As far as and then
takes me a little bit to fall asleep, but
Oh, okay, got it.
Sorry.
How long does it disrupt your sleep? Do you feel like you're not sleeping enough?
I don't get enough. I probably don't get enough sleep, but I am able to eventually go back to sleep.
Good to know. Then you also marked that you have a hot cold intolerance. Is that a new thing or is that long-standing? Like you've always just been kind of sensitive to heat?
So it's mostly the cold side of things, and it's kind of just like directly on the knee. It kind of just gets super sensitive, and I don't really like it very much.
Yeah. Well, especially when we're in pain, our nerves like to send a lot of kind of distress signals to our
Yeah.
brain. So sometimes it can be a little sensitive to that area. Keep an eye on it. If it gets better, great. If things get worse, or if something changes, be sure to talk to me about that. Yeah, sure. But we'll make sure to stay away from ice at least next
Could be
year.
related to your underlying fibromyalgia.
Okay.
Oh, you also have fibromyalgia. Okay, my mother has that as well. Yeah, so I know.
Yeah, I had that. The doctor diagnosed me with it like a few years back.
Okay. You feel like that's managed pretty well. I think I saw you're taking a pretty extensive list of medications. Are you taking medications for that as well?
Yes.
Yes.
Okay, do you feel like that's helping you when you do take the medications?
Yeah, it seems to help a good amount.
Okay.
Some of the times it can still be hard, but the medications seem to help.
Yeah, and that could definitely be contributing to the fact that you're in so much pain.
Yeah.
I'm sure you've learned about that condition a little bit, but
Yeah.
Your nerves are a little bit jumpy when that happens. So yeah, we'll be sure to take note of that and make sure we don't flare you up to that.
Yeah.
Okay. You also said you had a history of back and neck problems.
Yes.
Yeah, explain that a little bit.
I don't know. It's just my back's been hurting, and especially since after this most recent surgery, it seems to just be worse, significantly worse. It's not really my neck right now, but it's kind of like my low back area.
You mentioned on Wednesday.
Yeah, it just seems to be worse. I've had it for years, but
And describe when you do have symptoms in your low back. Kind of describe your symptoms. Is it soreness? Is it kind of a sharp pain? What do you
it's more just like a dull, achy feeling back here. And it just never seemed to go away with whatever I do.
Okay. So is there ever a time when it does go away or when you don't notice it?
Maybe like when my mind's kind of taken like distracted by it with like something else that I'm doing.
Right.
It seems to kind of go away, but it always seems to still be there. It's kind of frustrating.
Yeah, yeah. I feel that. Yeah, you never realize how much you use your low back until it starts to hurt, right?
Yeah,
Yeah.
exactly.
Then it's always a fun game after that. Okay, well, we'll keep an eye on that as well. Do you feel like that ever debilitates you more than the knee? Do you ever feel like the pain is worse there than it is in your knee?
Not since the most recent surgery, but it's still there.
Gotcha.
But the knee's more painful right now.
All right. Awesome. All right, and then I saw you had a history of CMV on there. Is that cytomegalovirus?
Yes.
Okay.
And it's resolved.
Okay, so no long-standing issues from that.
No.
Okay, good. All right, last couple of questions. I know we're kind of digging in deep, but
Yeah.
like I said, I want to make sure that I get to know the whole picture before.
That makes me feel a lot more comfortable just with everything that you actually know.
Yeah, good. So you put that your father had a history of diabetes, had a stroke.
Mhm.
Have you ever had any personal history of anything like that?
Not that I know of.
All right, no, good to know. Okay, and then you've had a couple of visits to home health to this point as well.
Yes.
Right.
Yeah.
Okay, talk to me about your home health experience. How was that?
The therapist comes in and they kind of just do the same things that I'm doing, that I used to do, like when I went to see, when I went to therapy in the clinic. They kind of do the same things just in my house. It's kind of nice having them there to help me with like the stairs and show me how to do it better on my exact stairs.
Yeah.
Because most of the stairs in like clinics, they're narrower. That's not really what I'm working with though. So that's kind of nice, but definitely don't have as much equipment there.
Well, right, yeah. What kind of stuff did you do in home health? So did the therapist come and did he stretch you at all? Did he have you do exercises?
It was a lot of stretching.
Okay.
Quad
And
sets.
some they had me just like pushing my knee like back into the table into a pillow or something.
Okay.
There's some other strengthening exercises.
Explain to me the stretches that they would have you do. So is that stuff that they gave you to do when they would leave, or would they just do that with you at home?
So yeah, they gave me some kind of program to do it away too, and it was a lot of trying to get my knee straight and then like trying to bend my knee. They kept saying range of motion, trying to get that extra range of motion.
Yeah. Okay. And how do you feel like that's coming along? Do you feel like that's working?
I'm able to do the exercises pretty well and like follow their program. I still feel like I don't have as much as I want, but yeah.
Okay. All right. And then do you experience like symptoms or pain when you do those? I mean, I know it's
Yeah,
not
it hurts.
comfortable, but
Yeah, it usually hurts.
does it flare you up to that top level of pain?
If I like really push it, it might go that high, but if I take it kind of easier and go a little slower, it seems to be okay. Maybe it won't get as bad.
Right. Okay, good to know. Okay, so before we kind of jump into the more physical portion of the exam, I wanted to know, so obviously you've done home health, you've been through this process before, right? So what would a successful trial of physical therapy look like to you? Because you had some goals on your sheet there,
Yeah.
and I just want to know kind of how would you deem this a successful GMT?
That's a good question. I think just getting back like that function that I have lost and helping with the pain. Those are probably the two main things that I would like to get back. like doing the stairs and walking.
Yeah.
But yeah, if I get that out of it, I'll be happy.
And then you wrote something on your sheet that said you wanted full range of motion in your knee. Define kind of what full range of motion means to you. Is that like you want to be able to, lean on your knees and
No, I'm
back
not.
to
I'm
the
not.
floor?
I haven't really been doing anything crazy. Like just walking. Like I feel like I can't even like walk normally,
Right.
With how bad my knee is.
Yeah.
And yeah, that's really about it. And like when I sit down, sometimes like my knee kind of hurts. Like when I sit down to it, and I can kind of make it more difficult to get up also. But so just getting enough motion for like those kind of activities, I would be happy with.
Yeah, good. I think we'll definitely be able to get that back relatively quickly.
Yeah.
We just have to also set the expectation that if you are in pain, we might have to slow play some things just to make sure that we don't make things worse or make you hate your life outside of the clinic, right?
Okay.
If you hate your life while I'm here, we're okay, right? But
Yeah.
if you hate your life outside of the clinic, I don't want that to happen.
Yeah.
So, okay. Well, is there anything else that maybe I haven't asked or anything else that you'd like to tell me kind of before we jump in?
I don't like we hit everything. Is there? Okay.
Okay, great. Well, are you okay if we do a little bit of a brief physical exam?
Yeah.
Okay, let's go ahead and do that then. So first thing I want to start off with, obviously you've been in home health a little bit. You had surgery just a couple of weeks ago. I just want to make sure that your vital signs are okay. So I'm going to do a quick blood pressure and then just a O2 reading on your finger there.
Okay.
Is that all right with you?
Yeah.
Okay. So I think you've used one of these before.
Yeah.
Right. So rub that on your finger here real quick. Just go ahead and just breathe normally for me.
So now I'm gonna just kind of give you an idea. I'm gonna touch here.
Have you had any problems with your breathing or anything like that recently?
You're right. Here. 70%. They give you a nerve block.
Okay, what I'm going to do is go ahead and kind of sit here, if you will. And then your sleeves roll up.
Let's just say it was 126/70.
Perfect. And then do you know what your blood pressure is normally?
126/70.
Okay, so about right there. So you're not nervous. I love it. Okay. All right. So what I'm going to do, I'm going to look at your scar a little bit, okay? Because I know it's been 2 weeks out.
Yeah.
Okay. So I'm just going to kind of look through here. Okay, have you had any problems with scarring in the past?
Just
No.
swelling.
Just swelling.
Yeah, it's swelling here.
Does it feel tighter or warmer than usual? Okay. It looks good to me. It does look good to me.
Almost like it's not there, right?
Yeah, it is.
Man, look at that. I've never seen a more perfectly healing thing.
Just swelling.
And then if you had any pain in your calves, or do you feel like you have any tingling or numbness in your feet at all?
Not that I've noticed. No, not now.
Right. What I'm going to do is, can you kind of straighten your leg out as much as possible for me? Just sitting right there. Are you comfortable sitting right here? You gotta sit right here.
I'm good.
Right here. All right. So is that about as far as it goes?
Yeah, that's probably about as far as I can go.
Let me actually hold off on that for just a little bit. Okay. Can you do me a favor? Can you swing your leg up here?
Yeah.
Can you do the hand with that? Yeah. And would you like it to look?
It definitely feels better.
Okay, let's do that just for a second. Okay.
Yeah.
Thank you. Yeah, you're very welcome. So what I'm gonna do is I'm gonna give us all just a curve measurement. So I just want to see kind of how big your knee is, just to measure your swelling.
Okay.
So we can make sure that it's going down
Okay.
as you do. Awesome. That makes sense.
General.
Here, so we're gonna do this leg first, just so I have a comparison. You go ahead and just let it kind of lie as flat as you can. Let's do this. Let's just see. Is that okay?
Yeah.
Squeeze my fingers real quick. Squeeze as hard as you can. Good. Like this one.
Mind if I move the lot just a minute?
Yeah.
Just can't. Just.
How about you add 5 centimeters, what you got?
I can do that too. Okay. I didn't know I could do that. But good to know. Okay,
You can't fake swelling.
that's true.
I could squeak. I could try it.
Yeah.
Think big.
Yeah.
Think swelling me. No, that doesn't work.
Okay, all right, so yeah, you are still a little bit swollen, right? That has to be expensive. 2 weeks out, so we'll keep an eye on that. and hopefully it'll cool down. Okay, so you said you've been working on strength for the BT a little bit.
Yeah.
So just in this position, so go ahead on the left side, squeeze that quad as hard as you can. Okay, do that over here. Okay, good. So you still got some good squeeze in there. That's nice. You can work on that. There you go.
Thank you.
Okay. So now what I'm gonna do, I'm gonna ball this up a little bit. Okay. And I wanna see, can you straighten this leg out kind of? Okay, relax. Okay, is that about as far as you go?
Yeah.
Okay, what do you feel like is holding you back? Do you feel like it's the strength? thing?
Yeah, I just feel like I don't. Straight it all the way.
All right, good. We'll work on that. Right. Well, you got some good strength there, so I like that though. This is coming. And usually what happens, I mean, especially when you have a major operation like this, is the quads like to shut down. It's
Yeah.
like, hey, something's happening, I gotta protect everything that's going on. So it'll completely turn off, right? It's like when your husband's yakking at you, you gotta protect your own life, so you shut your head off, right? So yeah, that's basically what your quads do. Don't tell us. I don't wanna get in trouble with it. All right, so I don't want you to, so I wanna use this. Just keep pressing that. So I want you to go ahead and bend this knee up as far as you're comfortable. Okay, start right there. Okay, then go ahead and lay out flat again. And if I just kind of pull up on your toe a little bit, that's a pretty good motion there. That's funny, it's like this knee didn't even get replaced. Okay, all right. I'll do this one. Okay. And I'll help you a little bit, but I want you to pull up as far as you dare go. Okay.
You're good.
So go right there.
Yeah, it's starting to hurt.
Okay, so go ahead and hold this right there. Okay, you okay just sitting like this for a second? Oh, I put this way too far away.
You can ask your aide for help.
be an aide.
You can ask.
Oh,
your
I didn't know I
aide.
had an aide. Michael,
Yes.
oh, just in the nick of time, so. All
Game.
right, come on in. Okay, thank you, sir.
Aides are priceless.
Oh, seriously, holy cow. Okay, relax. You okay if I just let you hang out like this for a second?
Yeah.
Okay. I know it doesn't feel very good. All right, we're not gonna spend a whole lot of time there. So just try to relax as best you can. Is that about as far as it goes?
Yeah.
Go from there. Relax a little bit. All right, a few things now.
Do you see that as active range of motion or passive range of motion?
So I would call that active.
Okay.
Definitely for flexion. You could quantify it as passive for extension,
Yeah, I'm just asking what you're
Yeah.
breaking it down.
but I
as.
wouldn't want to make him actively extend right now if he's having a lot of pain either.
You have to.
Have to, okay. Well, let's say I didn't. All right, so let's see.
You have to get a baseline.
I mean, forget my measurements.
Sorry.
No, you're good.
Good habit is to stop and let them down because you won't remember them otherwise.
Fair enough, fair enough. Okay,
Isn't Casper?
so
Really?
I don't want to do so. I just want to, can you move your ankle up and down on this foot? Does that bother you at all? Okay. And then what about your hip? Do you notice that you have any tightness? Up in your hip?
I don't know if I'd call it tight. More, I don't know. I just don't feel very strong.
Okay. Well, do you mind if I kind of get your leg and move your hip around a little bit?
Yeah.
So you're just gonna let me know you start having chronic pain? Is your knee okay with this?
Oh, yeah.
No problem up in the hip at all?
Not with range of motion.
What's that?
Not with range of motion.
Okay. Awesome. Okay. And then one of the things you mentioned earlier is that you want to start walking around without your walker.
Yeah, that'd be really nice.
Okay.
Not to have to drag that thing around.
How much walking do you do around the house?
Normally I try to do a fair amount. I used to like way before all my surgeries, I'd walk around the block daily. But now I kind of just keep it indoors and I do walk. Now I'm mostly just walking when I need to go get something, stuff like that.
Okay.
Gotcha. I'd like to.
Okay. Have you ever tried walking without it?
Not since the surgery, no.
Okay. So one thing I want you to do is I don't know if we necessarily have time right now. How much time do we have left? Should I be done?
Yeah, 9
Do
minutes.
you have your manual muscle testing? Do you have all of your objective measurements you need to document that today?
I have all the ones that I would like right now. So I could also do like just stand and do some weight shifts just to see if she can tolerate. He
I
can
think
tolerate.
it'd be really important to see this patient walk.
I just want to make sure we had time for it. That was it's in my plan. Okay,
Yes.
so let's try to walk a little bit.
Okay.
All right, this is your walker right here, I'm
Yeah.
imagining. So it's good to have you sit up on the edge of your chair. Take this way clear. All right.
Yeah.
Okay, so what I'm gonna do is I don't want either you or I to get burned eternally. Right? I'm gonna put this on you.
Yeah.
Just to get it over.
Ah, see,
You've been through the ringer, you know.
Have you do here, sometimes you lay down on the bed on your back then.
Okay, is that too tight? or is that
No,
okay?
that's good.
Okay, so I want you to show me how you walk.
Right.
And I'll be here to guard you just in case you need it. Okay, let's just kind of walk to that table. All right, Logan. Well, so we've done a pretty good amount today. How are you feeling right now? Do you feel okay? Do you flare you up at all?
Yeah, it kind of hurts
Okay.
a little bit.
Scale of 1 to 10,
Probably like a 9 right now.
9 right now.
Mm,
Wow, that's pretty excessive.
I was an 8.
You're an 8 when you came in.
Yeah.
All right.
So a little.
Well, you're sure acting like it. Yeah, so it will be sore sometimes, right?
Yeah.
But we don't want to take you up to the point where you can't stand it. Right?
Okay.
Discomfort is okay, but like if you lived here and you just curse my name the rest of the day, then I've done something wrong.
Yeah.
Right? So I want you to kind of monitor your symptoms. Obviously you can't ice, but what feels good at home?
It feels good just kind of lying down with like a pillow propped up.
Okay, good.
Heat seems to help some too.
All right. So do that at home, prop it up, throw some heat on it so you can relax a little bit. And then maybe take it easy the rest of the day, right? Don't go crazy so that we don't flare up. But basically, here's what we're gonna do. So I'd like to see you at least 2 times a week for the next couple of weeks, just so we can help control the pain, get some motion back. Your strength is definitely starting to emerge back, which is a good sign. Right? Some people, they lose strength for a really long time after something like this. But the fact that you can already squeeze your quad, you can already kind of walk a little bit with that walker group. So let's say for the next couple of weeks, I want to see you twice a week until we can get that pain down, get your motion back better. Then eventually we probably start working into about a once a week thing for a little bit, and then you won't have to see my movie.
That'll be good.
Okay. Do you have any questions for me?
I don't know. Do you kind of think like, or I don't know. I had a question, but
Should you still do the home exercise program you were given by your home health there?
I would, yes, because I would give you pretty much the exact same things, but it sounds like you're already doing them and you're on the right track. However, if you start to notice that either they're too painful or that they're flaring you up too much, then we'll change it up here. But as far as like getting your stretches in, right, try to bend that knee as much as you can comfortably, kind of sit in that position for a long time. And then try to get your knee straight as much as possible too. So if you can, prop your foot up on something so that you kind of leave that knee hanging a little bit. Do that for at least 5 minutes. Maybe when you sit there and watch it gun smoke or whatever you like to watch. Right? Prop your leg up, let it hang for a little bit. Do that a couple of times a day so that we can work on that motion first. Because we got to get the motion back. That's the biggest thing. It's going to keep you walking, get your strength back, and everything you want to do. So if we hit that motion, get it back ASAP, then we'll be in a good spot to build strength and get you back to what you want to do. But I would say definitely keep doing the motion stuff, and then we'll progress the strength stuff more as you keep coming. Okay. Any other questions?
I think that's it.
Right.
Good, nice job. Excellent. All right, so we
What's that?